Whether you have medical insurance or not, when a doctor prescribes treatment that is very important to your health, how much do you ask about the cost? When it comes to cancer, the National Cancer Institute projects the cost of care will top $150 billion in the next 5 years. The Centers for Disease Control and Prevention found that cancer survivors are less likely to work and more likely to struggle financially. Here to talk about this are Dr. Ron J. Rackett with Oncology Consultants, as well as Brandy Nestor, who has a son who's fighting brain cancer valiantly, and you are helping our community in a beautiful way as well. Good morning to you both. Thanks for being here. First of all, let's just talk about, you have medical insurance. It's helped you a whole lot, but there are so many costs. Let's talk about just sort of the typical day. You've got physical therapy. How much does that cost per day? $900 per day for physical therapy. Then you've got parking, which can be, if you have 2 cars in the medical center, it can be $30 a day. You've got food while you're there. And for jobs, a lot of people have to quit their jobs.
Right. I actually took off for 6 months to be with my son, but it's not something that you're doing day to day. It's something that progresses over the years, and you have to do it for a long period of time. And every cancer is different. So brain cancer is different from colon or breast or what have you, but the cost has gotten out of control. And lucky for us, our insurance has covered it, but some people don't have insurance that's able to cover that, and so they're fitted with these bills.
And I'm sure you see the stress of that. I know that I do when I'm in the medical center of patients wanting to fight for their life or wanting to help fight for their child's life, and they can't because they're so stressed about finances. Do you see that a lot?
All the time. That we've got a whole group of mothers there at the hospital who constantly talk about, how are we going to pay for parking? How are we going to pay for staying near the medical center so that we can be there every day for our child's appointments? So it's a financial burden.
Dr. Rackett, I think it's interesting where you work, because you have incredible training from MD Anderson, but at the same time you are at a place where it's much more affordable than a lot of cancer centers, and that helps patients a lot, doesn't it?
I think so. I think it's important for patients to remember there's a choice for oncology care in the city of Houston, and our practice is about a quarter of the cost of some academic institutions. However, maintaining quality. We're one of the first 2 quality oncology practice initiative practices in the state of Texas, and we have excellent providers there providing excellent quality.
I know your job is to save patients. You as an oncologist want to make them better. Right. But at the same time, do you feel and hear the stresses of finances from patients? Do they talk to you about that?
Absolutely. We feel it every day. I mean, there's something called financial toxicity that patients experience, and just like a toxicity from a drug, financial toxicity is important. And there's patient access foundations that our practice goes through and tries to access for patients, and through financial counselors. And we also try to work with them as far as seeking out other funds from charity organizations.
And you have found that is very helpful, and want parents to know about that a lot of local hospitals do have charities, and you found out through that, and it makes a big difference, doesn't it?
And you don't think you might qualify for it, but just try, because there are different avenues at every facility that will give you a little help.
And so it makes a big difference in just
difference.
overall life, again, so that you can fight for your life, if that's the case, or your child's, and not have to worry about the money at the end of the day. Thank you for being here. I encourage everyone to look up Bennett's Bears to find out what you're doing. You're making a big difference for children with cancer through your precious son. Thank you for giving back to our community. And thank you, Dr. Rackett, for being here to talk about this very important matter.
Thanks for having me.
Good to see you both.
You too.
Good to see you.